Hi again, everyone. I'm Marty Guthmiller, CEO of Orange City Area Health System, and we're bringing to you today the 20th edition of the COVID-19 Community Briefing. Thank you for joining us. I don't have a lot today, but I want to give you some stats today, and I wanted to come today to make sure that I had the stuff from the weekend. Yesterday, when we recorded this, we didn't have the updates yet from the weekend, and so the numbers that I have today will include that. We're going to step through again from the local to the county, to the region, and to the state, and give you those totals. First of all, locally, we have performed 151 tests here at Orange City Area Health System. That number was 116 yesterday that I reported. So we have jumped up quite a bit as predicted, because we're testing a lot of our pre-ops and OBs now, and we'll talk about that a little bit more. While the number of tests have gone up significantly here, we have had no more positives. So our positives remain at 11. So 11 out of the 151. We've had 124 confirmed negatives, and we have 16 tests that are currently pending. Most all of those 16 tests are pre-op screenings. So pre-operation, pre-procedure, and OB. And so those tests are pending. We do not expect those to be positive, but again, they're being done on a preventative, cautionary basis. Jumping up to the Sioux County level, Sioux County has performed 744 tests. 146 of those were positive. The number of hospitalizations in Sioux County, by the way, and I'll give you a bunch of county hospitalizations here, but is my understanding and is the best information we have is one currently hospitalized in Sioux County. And also, it's my understanding that that may be a false positive. So the patient is being treated as if he or she were positive, but we believe we have some information that that might be a false positive. In terms of the counties around us, in addition to the one in Sioux County, O'Brien, Lyon, and Plymouth County have 0 hospitalizations, so that's good news. Woodbury County, just to our south in Sioux City, has 57. So you can see there's a dramatic difference once we get outside of this 4-county area into just a little bit south in Sioux City at 57. Polk County in Des Moines leads the way right now, and this is not kind of like golf, the higher score, the worse, right? Is 122. So 122 of the 355 COVID-19 patients hospitalized in Iowa are in Polk County. So again, 355 in Iowa, 57 in Sioux City, 1 kind of in Orange, not in Orange City, in Sioux County, and again that may be a false positive. Stepping up from Sioux County into Region 3, we have some information again to share there. Not a lot different than before. Current patients hospitalized in Region 3, which again includes the 20 counties in Northwest Iowa, including Woodbury County, is 88. Yesterday, that number was 81. So we've had 7 additional folks hospitalized in those 20 counties overnight. There's 34 people in the ICU in Region 3 versus 32 yesterday, and 10 patients were admitted in the last 24 hours as opposed to 6 the day before. So Region 3, all 3 indicators are a little bit up, but minorly. And so just wanted to share that information with you as well. Going up then to the state level, at Iowa, we've had 15,296 cases. That's up from the previous reporting, and 107,196. I think I can tell you that the previous number in Iowa I can't tell you that. I don't have that information. Anyway, it's gone up in Iowa and is at 15,296. The deaths in Iowa went up as well at 367. The number of deaths in Sioux County is 0. The number of deaths in Woodbury County is 17. So it gives you a little bit of an idea, not only the severity, but the location of those infections as well. A number that I find kind of interesting, again, is how many Iowans have been tested. Currently 1 in 29 Iowans have been tested. The last number that I gave you was 1 out of 34. So that number is coming down, but it's still a very small percentage when it comes right down to it. One of the areas that I can point you to look at, if you be careful with this, because you can spend a lot of time with it, and remember that we want to be healthy in our approach to data. But there's a website that is called coronavirus.iowa.gov. And if you go to that, you can look up all kinds of stuff by county, by region, by state, hospitalizations, all those kinds of things. Again, it's coronavirus.iowa.gov. You can check that out if you want. One of the things that we learned yesterday coming out of the CDC is that there are going to be additional guidance material provided for senior care, for nursing homes. That's going to be really important as we move along. We want to move as fastly as we can in this area, but we need to go as slow as we ought to also. Our most vulnerable population obviously resides in nursing homes. There have been many outbreaks across the state of Iowa. We want to keep it out of our nursing homes, but we also want to bring families together again, to let spouses actually be in the room together with each other, for those kinds of things to happen as soon as it safely can. We're also hearing now that there will be some guidance from Governor Reynolds in the state of Iowa in terms of how we reopen nursing homes. Again, I would not expect anything real swift in that area because of the stakes. I think there's an awful lot going on. We will be very deliberate. We will follow those guidelines, and we will go as quickly as we believe appropriate medically. So anyway, more information to come on that hopefully in the next few days. As I close, I just want to remind you, and I don't want to repeat a bunch of stuff, but just some reminders. Try to control the things that you can control, and pay particular attention to some of these comorbidities that I've mentioned before: blood pressures, blood sugars, weight levels, those kinds of things. Work on those things. Control the things that you can control. Use common sense as we go about our lives. I proved last night, by the way, that there are haircuts after COVID-19. I got my first haircut last night. I needed it quite badly, but even that is just an idea of returning to normalcy, and something as simple as getting a haircut was something that, it took a long time in coming. I had to kind of think about it a little bit, but anyway, hopefully you like the haircut. Anyway, I have it. So try to control the things you control, use common sense, and live life. Thank you again for joining us today. Stay strong, stay vigilant, and stay healthy. Thank you.